Now, the ARTE molded threads we are using primarily because this patient does have some heavier tissue and we are going to need some added strength. The molded threads are about 25% stronger than the regular barbed lifting threads of VSoft Lift, when their regular lifting threads are about 20% stronger than anything else that's on the market. So you can imagine these are going to be nice and strong and give us the best lifting there. There are times that we use the regular barbed threads because for regular tissue, thinner tissue, those will do the job. But for this case, we are going to need something that is a little bit more robust and be able to really pull back. So now we are creating, with that pilot hole needle, two planes. We're going in the two directions that you see that these neck threads are going, and only do this if you have real certification training, especially in the neck area. This is an advanced procedure, but you must have live patient certification training by the AAFE. These are exclusive AAFE techniques, and couple that with the best thread that's out there, then that is how you're going to get the best result with the fewest amount of threads, the amount to do the job. There's a ComfortDocs microcannula again, 25 gauge by 50 millimeters, and you can see we're getting it to place. It goes very easily to place because it's the bluntest microcannula out there, and it also is a stiffer microcannula. It has the right flexibility, and it will not dive on you, and that is key to pre-tunneling. This pre-tunneling puts everything in the right plane. Once you understand and are properly trained and you get into that right plane, the rest of it goes so much easier. And you can see how comfortable this patient is. And here she is getting a little bit of retrograde injection of lidocaine 2%, no epinephrine. In this case, as you see, always know where you're at. Now, you better darn well know the anatomy here. That's in the jawline and especially in the neck where the skin is going to be thinner. And obviously there is some really important anatomy in the neck as there is everywhere else. But certainly in the neck, you've got to know exactly what you need. So now we're going to measure that out again. Go find that pilot hole, and which we've already gone into. We know we're going to be in the right plane if you go at about a 5 to 10 degree in there and just follow along that tunnel that's created by the ComfortDocs microcannula. So you can see this is a beautiful step-by-step approach, and you can see how easily it goes there, always checking with your other hand exactly where is the tip of this instrument so we can deliver this ARTE molded VSoft Lift thread exactly where we want it. And that is the only thread VSoft Lift is what we use in AAFE training because it's the best. Now, pull it out at the same time. You're going to really extend and pull on that tissue, and that's going to engage the thread. And literally, you hear this click, 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 click as it attaches to the tissue here. So now let's go ahead and do the other direction that we want. And wait till you see this, this side by side. It's going to be amazing. A half face side by side. This will show you what we're really accomplishing. And remember, it's only 3 threads that we're using on this side. Any other PDO thread system or brand is going to need at least 6 to 8 to 10, some of them, threads to do the same job. Why would you want that for yourself? You wouldn't. Why would you want it for your patient? You shouldn't. And this is why that combination is the best tool, the best techniques, the best PDO thread will give you the best results. Really extend that tissue, pull this all the way back, and now you've attached to the SMAS layer in the face, in the neck, and you are pulling on it, and you can see this great, great result. And let's show you a side-by-side. And this is a halftime shot, as you can go ahead and see right there. That is fantastic. Look at the right side of her face, which is on the left side of your screen. Look how it's pulled up. Look at her neck. That's amazing. Look how smooth it is compared to the neck on the other side, which hasn't been done yet. You need to add this to your practice, and you need to get AAFE certification trained today.